huge implications for high school football, Friday night football. Jeff Reddick is covering this news conference. Jeff is on the phone. So, Jeff, we know sports is going to be a big focus, and it sounds like high school sports will be allowed to proceed.
Yes, even tonight we've learned that the governor will have a video conference statewide with superintendents, principals, athletic directors, and then the coaches of 4 different sports: football, cross country, and soccer and field hockey, also volleyball too, actually, so 5 sports. So, yes, all indications are that sports will proceed. There might be some different rules for each of them because he's talking to those coaches and athletic directors differently based on the timing of the sports. But then, of course, we know that there are already going to be restrictions on certain sports as far as fans in the stands. He's going to ask for the leadership of coaches on this to help navigate their student athletes and their teams through the pandemic successfully and safely. There's a lot we don't know yet about masks on the sidelines, for example, social distancing on the sidelines, and any testing guidelines for players. So there is still a lot of news to come out yet. We expect to hear that just in a few moments now.
And Jeff, the governor is big on pointing out successes when it comes to COVID-19. We have now had 3 days in a row of new cases under 1,000. Today's case report comes in at 861 new cases in the past 24 hours. I think we'll expect him to talk about that as well, right?
I think he would. And, something we've heard from the governor in the past and from his team is that you see reduced numbers on weekends and on Mondays. And generally on Tuesdays, you might see that bump of over the weekend stats coming in and jumping the Tuesday numbers a bit. But certainly 3 days in a row below 1,000 is a good milestone no matter what for Ohio to hit. We'll just have to see if it holds. And if it holds in those other important statistics like the rate of spread, the hospitalization rate, and down the line, the mortality rate in central Ohio and statewide as well.
So along with the governor today will be the Lieutenant Governor, John Husted. Also, the First Lady of Ohio, Fran DeWine, is expected to speak today. Jeff, do we know what she'll be talking about? Have you been given any idea yet?
What I can glean from that, Adam, is that generally Fran shows up at these briefings when there are issues of family importance or issues involving children. Governor DeWine is very ready to lean on her at any time that there's any kind of familial issue that comes up, something about caring for children, because, as he says many, many times, the couple together, the DeWines, have several children and a whole bunch of grandchildren. So he definitely leans on her in that regard. I would expect, because we are talking about high school sports, because we are talking about people's children out there on the pitch, the playing field, that's what her role is, probably a role of reassurance. And she may have even had a voice at the table, certainly in the governor's ear throughout this. And he's always more than willing to bring her in and have the First Lady, Fran DeWine, help explain some of his decision-making.
And Jeff, we're looking at the State House right now, a live picture. But the governor, is he expected to be back in Columbus today, or is he still going to be at his house in Cedarville because of that false positive test he got the other week?
Yeah, we've confirmed that the governor is going to remain at the Cedarville location for today. We don't have any future guidance. His spokesperson was not sure how long or how far this would last. But yeah, after that kind of testing debacle, even though he has 3 negative COVID-19 tests in his pocket, PCR tests, which are considered to be pretty darn accurate, the governor has remained and will today remain on the Zoom call from his Cedarville home. So you'll see that video bouncing around between him and the lieutenant governor and probably some other folks today.
All right, the governor taking the podium right now. Let's listen in.
Joining me in a moment, talk a little bit about the Dolly Parton Imagination Library and the progress that has been made in the last year. Wearing a tie from Hiram College. James Garfield was a graduate of Hiram. This is the 100th anniversary of women's suffrage. 100 years ago, August 18th, 1920, Tennessee became the 36th and the final state to ratify the 19th Amendment to the United States Constitution. Ohio, I might say, had already ratified the 19th Amendment more than a year earlier on June 16th, 1919. I think back, think about where my grandmothers were. My grandmother, Little, had just turned 20, and my grandmother, Alice DeWine, was 24. So my grandmother, Ruth Little, was 20. And I just wondered what they thought about that. I remember my grandmother Little talking a little bit about that, but I wish I had the opportunity now to really ask them how that was. This is also a interesting year for women 100 years ago to get the opportunity to vote, particularly for Ohioans, because the choice for president, they had two Ohioans. Warren G. Harding, newspaper publisher from Marion, Ohio, and James Cox, a newspaper publisher from Dayton, Ohio. So quite a year. In April of last year, I signed Senate Bill 30, which created the Women's Suffrage Centennial Commission to commemorate this milestone. Now, with the onset of the pandemic, our ability to really celebrate, in person at least, has been curtailed. But I encourage everyone to learn more about the history of the women's suffrage movement. The Ohio History Connection, a good place to learn a lot of things. Has many resources, including for teachers on its webpage at ohiohistory.org. And Tourism Ohio has created a women's history road trip that features 8 different sites, and that is at ohio.org. You also might want to ask anyone in your family who was alive then and ask them what they remember from that time. Let me now introduce my wife, Fran, who's going to talk a little bit about the Imagination Library and results that we have had so far. And she is wearing a Votes for Women.
Good afternoon. I also have on a special mask today that you can see through. I read an article this past week about 2 young women at Miami University's taking a disability class. And these masks are made, one of the girls was making these actually for kids who have disabilities so that, that you could read their lips. And so I think this would be a great thing, if you have a child that needs something special, I think this would be a great thing. I actually found 3 different patterns. One of them is shaped kind of like a smile that you can wear. And this one actually kind of has a chin in it. So there are a lot of different patterns online. And the trick is it's a vinyl insert. And if you put just a drop of dishwasher soap on it and then wipe it off, then it won't steam up when you're talking. So, but during this pandemic, a lot has changed, our work routine, our kids, but a lot of things are the same, and still, these kids are growing up, and we as parents are their main teachers. We're their best teachers. And so I hope that you're tapping the resources of the Ohio Governor's Imagination Library. If you have little ones under 5 years old. Now, if you remember this, these are books free in the mail for children. They get a book every month from the time they're born until they turn 5 years old. So we'll hope you'll make sure your kids are signed up. I just put a couple of these books out here. My very favorite book is the very first one they get. It's The Little Engine That Could. Every child gets this, no matter what age that they are when they sign up. And another favorite over the years, and I love reading this to kids because kids love reading it themselves, it's The Very Hungry Caterpillar. So it's just a great book. But we really started about a year ago here in Ohio. And it's been quite a year since we started. We've expanded this program. It was here and it was in many, many areas, pockets of Ohio, but we expanded it to almost every county now. So we're hoping to make sure that every child gets it. Last summer when we started our push, it was available and about 93,000 kids had signed up. Today, with the help First of all, our friends from the state legislature who put some money in, and our county affiliates who've signed up. And we've got lots of, new funds. And so now we have over 180,000 kids signed up. So we've more than doubled. I visited myself just this year, between January and March. I visited 16 counties. And just recently, we added 2 more counties. We added Claremont County and Morgan County. So we're really happy to welcome them. So now it's available countywide in 78 of Ohio's 88 counties. And after 1 year, we've doubled it, so that means 191,000 kids are getting a free book in the mail every single month. So in the remaining 10 counties, we really hope to get those up and running soon. We're looking for partners to make sure every child in the county can receive those books. These 10 counties, Ashland, Columbiana, Crawford, Lake, Mercer, Ottawa, Richland, Sandusky, Seneca, and Van Wert. If you can help, please contact us through our website, which is the ohioimaginationlibrary.org. In September, we'll be celebrating our 1-year anniversary.
Those counties are not. Those counties don't have them.
Those counties do not have it yet. We'll be celebrating our kids and families, our community partners, and our legislators who are investing in our children. But I know we have more work to do this year, and I look forward to the day, hopefully very soon, when every child in Ohio is receiving the benefits of the Ohio Governor's Imagination Library. Thank you.
Thanks, Fran. Fran, I want to send our best wishes to State Senator Tina Maharath of Columbus, who announced on Twitter last night that she and some of her family members have been diagnosed with COVID-19. So our prayers go out to her and to her family. We learned last night that we now have our first confirmed case of COVID-19 at our Ohio Veterans Home in Georgetown, Brown County. An employee has been tested positive. The Ohio Department of Veterans Services had been able to keep the coronavirus out of this nursing home all this time since the start of the pandemic, but sadly, we are seeing more community spread in our rural counties, and certainly Brown County has significant community spread. It's one of the 12 counties in a red level 3 public emergency this week. The employee has not been at work since Thursday morning, but it appears that at least 2 other employees may have been exposed to this individual. This has triggered Veterans Services to put additional safety measures in place at the home, and they're tracking all potential exposures. Because we've been testing staff in Georgetown regularly, all staff had already been scheduled to be tested yesterday and today, and that is taking place. Additionally, all residents in the unit where this employee works are being tested, as are the residents in the 2 other units where the potentially exposed employees are assigned. As we do each day, we will continue updating any change in case numbers at Ohio's 2 veterans home on our website, coronavirus.ohio.gov. So today we're going to talk about sports. I know a much anticipated subject by many people throughout the state. I thought we would first talk with Dr. Jim Borchers. Dr. Borchers has had extensive experience in working in this particular area at Ohio State University. And Doctor, are you on here yet? Eric, is he here?
I am here.
He's up. Doctor, thank you so very, very much for joining us. And I know you've worked with athletes at Ohio State. And I wonder maybe if you could just kind of start off by telling us what you have learned. I mean, I know that we continue, the medical community continues to learn more as we move forward with COVID and have more experiences, and it's an evolving situation. And maybe just kind of share with us some of the things that you have seen at your work at Ohio State in general and your work with the athletes.
Well, Governor, thanks for having me today, and very happy to be here. You know, our experience has allowed us really to study the effect of COVID and its effects not only on athletics, but on sport and participation. And I think probably the first thing that we've learned is that the health of the community around our athletes is of utmost importance to our athletes being able to compete. When we are able to provide our athletes with a healthy environment and are able to have them follow the basic behaviors that we've all been asked to follow around this virus, which is appropriate social distancing and good hygiene, face mask, and following proper procedures in and around sport facilities and around conducting athletics. That makes a large difference for us. When the community does not have a healthy environment, when we see a large infectivity rate, we have found that it's more difficult, and we struggle sometimes to have athletics and sport and organized sport. So I think that is probably first and foremost the most important thing. And I think the second thing we've known, and I think everyone knows, is just how important athletics and sport is to our mental health and well-being, and how important it is that we all join in together to allow sports to occur.
Well, that's great. And Doctor, I apologize. I kind of rushed into this. I was anxious to hear from you. I didn't really give you the proper introduction, but let me just do it for everyone. Dr. Borchert specializes in sports medicine at the Wexner Medical Center. He's some firsthand experience as a former Ohio State football player from 1989 to 1993. We'll give your age away, I guess, there, Doctor.
Getting old.
There you go. He was inspired to be a doctor in part by his physicians who cared for him when he was a student athlete. So, Doctor, thank you very, very much. We have heard, Doctor, one of the things that is in the order that we're putting out today talks about myocarditis, but also sudden cardiac arrest, which I know has been something that I think people have been concerned about for a long time. I remember years ago seeing that tragedy reported one night for a UD basketball player. I have a good friend of mine from Congress whose son died at a very, very young age playing college basketball from that. So maybe you could start with that and then talk how those two are maybe are related or not related, but just some things that coaches and athletic directors and everyone else connected with sports maybe should think about.
Sure. Well, I think, as you mentioned, sudden cardiac death in athletes is a tragic event, and it fortunately is a very rare event. It's not something that's common, but something that we almost always hear some reports of, and really requires vigilance on preparation. So all our great athletic trainers around the state of Ohio that are providing excellent emergency care, our CPR training and the use of a automated external defibrillator are really the ways that we can, save lives. And so even more important than screening is our preparation. And so obviously I know our coaches, athletic trainers, medical staffs, administrators around the state really take a lot of great pride and have done a great job at instituting that. That being said, we know one of the risk factors for sudden cardiac death is infection of the heart, or what you've mentioned, myocarditis. And although not the most common cause, can be a cause of sudden cardiac death and arrhythmia, certainly in athletes. And one of the things that we continue to study and look at with COVID-19 is its predilection for potentially affecting the heart with infection. And so it's one of the issues that has been discussed quite a bit. It's one of the issues that we're learning quite a bit about, and certainly that we want to remain vigilant for. But I think it highlights the need for, again, prevention, for healthy communities, and trying to allow, rather than worrying about what we do when that occurs, which is a rare event, how can we prevent it from occurring? And I think those are those things that you and others have talked about in trying to allow our athletes to compete in a healthy environment.
So let's talk for a moment. Let's say an athlete who has the symptoms of COVID. let's just assume they're tested, comes back positive, athlete does not exhibit, any kind of major problem, never has to go to the hospital, for example. That person's now hopes to come back and play. You're the doctor. What do you advise the coach? What do you advise the parents? What do you advise the athlete?
Yeah, I think what I would advise everyone, Governor, is that athlete, if they've been COVID positive, meets with their healthcare provider and makes certain that they have discussed, the health risk and that they've had a complete assessment before they return to sport. And that may then, be different for each individual. And so certainly that could involve not only an exam, but other cardiac testing, EKGs, echocardiograms, lab work, other specialized cardiac tests, and the use of a cardiac specialist if needed. But I think anyone who's been COVID positive needs to meet with their healthcare provider, seek out that advice before they return to activity, to make certain that they understand also the signs and symptoms to watch out for: shortness of breath, any chest discomfort, exercise fatigue, a middle-aged runner who maybe used to be able to run a 8-minute mile that's now only able to run 12 or 13-minute miles. These are the things that might alert our healthcare providers to looking at something more specific. So not that we need to be, I think, overly scared of this complication, but we need to be aware of it.
Okay, very, very good. I asked you this morning a question. I said, if you had a child who wanted to play contact sports this fall, would you let them do it?
Yeah, you did ask me that question, and I've been asked that question quite a bit. And I have 2 high school age boys who play sports, a daughter who was a very competitive athlete. And my response to you is the response I'm going to give now, and that I think that every individual needs to look at what's going on in their environment and kind of what their community looks like. If the infectivity rate of this virus is extremely high and we don't have the ability to test, I'd have some real concerns about letting my son play a contact sport. That being said, if I lived in a community where the infectivity rate is well controlled, where it's low, where I felt like our community had embraced the guidelines to allow the athletes to compete in a healthy manner, then I would, feel better about letting my son go forward. So I think you have to take into account what's going on in your local community, what's going on in your, more extended community. And I think that's why it's so incumbent on all of us to do the best we can to prevent as much spread as possible.
Okay, good. Doctor, thank you very, very much. Maybe one last question. In regard to a situation where one of the athletes on a team comes down with COVID. It's confirmed that student has COVID. What does that mean for the other athletes on that team, or what might it mean? I guess it's fact. I assume it's fact driven pretty much here, but what might that mean, or what should happen?
Sure. So I think first and foremost, we want to share information to prevent the, unnecessary spread of that. So we want to make certain that that we make those aware that there could be a positive case. And then I think that's where contact tracing, as we've heard a lot about, becomes so important, that we don't have an unnecessary shutdown, so to speak, of a large group of people, that we have the ability to make certain that those close contacts are appropriately notified and follow CDC guidance and others on self-quarantine. The inability to do that, or the inability to provide that information, is probably going to lead to health departments recommending that entire groups of people, entire teams, or even entire leagues potentially not participate for a period of time, and that can be really disruptive to sport. So certainly that sort of communication is going to be really important, and something that we need to be very vigilant about.
Great. Doctor, thank you very, very much. We appreciate you being with us.
Thank you.
Thank you. Eric, let's go to quickly to our slides here. Eric is behind the camera trying to do a bunch of different things at one time. This is our regular slide that comes up. As we'll see the cases, we don't like to see any cases, but that number is better than some of the numbers we've been seeing. 861 deaths, tragically 39 people. Hospitalizations we see also are up, and ICU admissions are up. Eric, if we could go to the latest version of our top 10 Ohio counties ranked by incidents. These are, I believe, new numbers. Let me look at the dates here. Yeah, this goes up to today. We'll see that, and these are, again, counties where we're trying to compare based on population. So how much has there been spread? What are the number of cases in the last 14 days based on population? So it's last 14 days per 100,000 population. Mercer County is at 245, still number one, although down a little bit. Darke County, Lawrence County, Meigs County, Preble, Shelby, Sandusky, Perry, Champaign, Auglaize. So for the first time, the top 10 counties are basically rural counties. And this is what we continue to see. We continue to see this significant spread out into our rural areas. So it is obviously very, very concerning. We do have good news. The positivity overall statewide is coming down. And we're happy about that. And we're also seeing in our urban areas generally a lowering in the number of cases. And so that is good. So we will be issuing an order and best guidance in regard to sports. This is really the best guidance that can be provided by the health experts and the medical experts. But the caveat always is that, like anything else in life, it depends on how it is executed. So we would just ask people when this comes out within the next day, just take a look at it, kind of go through it. But let me give you the highlights. So we will be releasing this order, and really it's about how we can provide the best advice to how sports in Ohio are conducted. This includes not only high school athletes, not only situations that are under the Ohio High School Athletic Association's umbrella, but any kind of sports, organized by basically anybody in the state. So it applies to all athletes, all teams, whether under this umbrella of the Ohio High School Athletic Association or not. We have certainly heard from parents. We've heard from athletes. We've talked to young people, coaches, doctors, and health experts. Just maybe a few thoughts about this and kind of our thinking process. We know, first of all, that just as going back to school in person does increase the risk of spread, we know that sports do, particularly contact sports. They do as well. Further, we know that, as Dr. Borcher said several times, the more spread there is in a community, the more spread there's going to be in the school, and the higher risk there's going to be to the students and certainly to the athletes as well. On the other hand, we all know the importance of sports. We've seen that. Fran and I have seen that with our own children. We've seen it with our own grandchildren. Sports matters. It makes a difference. Sports provides all the things that we know. Discipline, brings order, structure in the lives of student athletes, and certainly brings joy to those athletes and certainly to their families as well. Any decision about playing sports or not playing sports simply cannot be made in a vacuum. That young person, if they're not playing sports, will obviously be doing something else with their time. And that has to be kept in mind as well. We also know, of course, that each young person is different. Each young person has different needs. Each young person is at a different point in their life with different needs, different situations. Again, our order provides what we hope is the best guidance to play sports as safely as that can be played in the era of COVID-19. So our order will provide that all sports may go forward this fall with contact and the non-contact sports. Again, we lay out exactly the roadmap and how this should take place and what has to be done to make it as safe as possible. We also, though, have heard from superintendents, we've heard from families for a desire to switch some of these contact sports, football, soccer, field hockey, to the spring. Lieutenant Governor and I have had conversations with the Ohio High School Athletic Association, and they have given the go-ahead for schools that want to do that to move to the spring. As we go through this, frankly, we know some schools are still deciding. Some schools have already made up their mind. They've already announced. Our goal is to provide, is to focus on the student and to focus on the school and to provide them the best opportunity they can so that that young person can participate. No one can guess what the future is going to be. We don't know, frankly, what the situation is going to be or how far into the season we'll be able to get, or if we can get all the way into the season. We certainly hope right now. Nor can we predict if things will be better when it would become time to play these sports in the spring. But this order simply allows sports to move forward. And we have heard it expressed by some superintendents and others that they would like to be able to have a season, but they don't want to have a season now. We've certainly heard from other schools and other parents who say, we want that season now. We think this is the best thing to happen for many, many, many reasons. We have noticed that a good number of our urban schools, our city schools, have decided not to go back in person, and they've also decided not to have fall sports. So if there was no opportunity in the spring to play, and again, we can't predict the future. We don't know what that's going to look like, but there is hope, and they will at least have hope, and we hope actually a season. They've already made the decision not to play in the fall, so we don't want to exclude those children either. We want to give them the hope and the opportunity to also have a season. Under our orders, let me talk for a moment about spectators. Everyone I've talked to, virtually everyone I've talked to, has put the focus exactly where it should be. And that focus should be on young people, letting them play. It's also important, I believe, that that young person have someone there, if possible, to support them. There are people there. Many times it's family members. Sometimes it may be someone else who's very, very close to the family or very, very close to that particular young person. So when our order comes out, what you will see is that we will not have spectators other than family members or people very close to that particular child. And we'll leave that, of course, up to the school, how to do that. We also know, if you talk, for example, football, and other sports too, but I associate this with football more, and that is a marching band. That might be a drill team. That might be other things that happen during halftime. And so we would want to provide an opportunity for those parents as well to be able to come and observe what is going on. So we'll have more details on that when the order is actually issued. But that's the basic underpinning in regard to spectators. I think what you'll see when you look at the orders is no big surprises. So the health guidance that is in there is pretty much the guidance that you have heard from us, but you've also heard on TV, you've read in the newspaper. No big surprises. I would just express a hope. I have a lot of hopes, but one hope is that the desire to have a season, I hope that the desire to have a season will inspire our young people, our athletes, our student athletes, 24/7 to be as careful as they can. And I hope also that our coaches, and John Houston and I will be talking with coaches later today and several different calls. We're also going to be talking to superintendents, athletic directors on conference calls. But our hope is that the coaches will use this as an opportunity to focus on helping these young people understand what really is at stake. And that if they're going to be able to play whatever sport it is they're playing, whether it is soccer, or football, whatever it is, that they're going to have to do everything they can to keep COVID out of their team. So I hope, and I believe it will work, the driving force that will inspire our young men, our young women, to make decisions in their lives 24/7. And I hope that will inspire them to make the right decisions, to give them the opportunity to have the best chance they can to play their sport. To the coaches, you in a normal year inspire, you mentor, you instruct, you instill discipline, self-discipline to your student athletes. For all of that, we're very, very grateful. Parents, grandparents, everybody else connected with that child, we're very grateful for what you do. You make a lot of sacrifices, you work long hours, and you inspire our kids. And so we thank you very, very much for that. But this year, it's going to take more. It's going to be inspiring them in regard to the goal of keeping COVID out.
A major announcement from the governor this afternoon as we take a break from that feed for just a moment. He has announced that high school sports can go forward. In fact, all other sports can go forward, fall sports. He's highlighting the main points. It includes not only high school athletes, but any kind of sports in the state. He also said the more spread there is in a community, the more spread in a school, and the higher risk to student athletes. So everyone has to pay particular attention to that. He said all sports may go forward, contact and non-contact. There has been some desire to switch football, soccer, and field hockey seasons to the spring, and the OHSAA Sports will approve that. Some schools are still deciding if they will have a season. And then I also saw somewhere he also had mentioned about marching band. He said marching band will be allowed to perform at the game. So again, the governor has given the order on fall sports. Sports will be allowed. When it comes to spectators, students will not be in the stands. It'll only be close family members who will be in the stands cheering on their athletes. So let's go back to the State House right now, see if they have fixed the feed at all. No, they have not. So as I pull up the social media, I'm looking for the governor's social media account. So to better explain, he was going to get into specifics when the feed froze. Let me go back a little bit. Again, we are waiting Governor Mike DeWine. All right, we're going to go to ABC right now, and we'll come back when the State House feed is fixed.